So welcome back. This is the second episode of our reasons behind choosing NCKU. And you are still with us, the International Advanced Program in Nursing students from the Department of Nursing in the College of Medicine of NCKU. And right now, we have discussed already the reasons behind choosing this school. Now let's focus on what we found out and what we have learned so far now that we are here. So let's get on with this second set's question. Looking back to our journey here at IAPN, I realized that we are not only developed to become effective teachers. We have many different options in a field that we want to pursue after the program. We could be an advanced practicing nurse. We could be a nurse researcher, or we could be a faculty member. So I just want to focus more on these three areas of our curriculum and what sets this curriculum different from all the other international programs. So let me just start off with the clinical skills and the related learning experience. So far, in your experiences, Miky, in health assessment and physical examination in our course, what was the greatest lesson that you have learned?
For the health assessment course, I actually like the interprofessional disciplines in the medicine field because Professor Shingmei will bring a specialist for each and every topic. For example, when you are doing the cardiovascular presentation, she'll bring a cardiologist to class to teach you more on the cardiovascular system. And more important, it was the objective subjective clinical examination, which was vital in ensuring that all the skills that I've acquired from health assessment are rated, and I can actually see how good am I based on the OSCE exam. I feel like it was good.
And I think OSCE, or the Objective Structured Clinical Examination, is a standardized skills-based evaluation for those aspiring practical nurses, or should I say nurse professional, which I guess is a very good opportunity in Taiwan because we are exposed in that kind of skills evaluation. What was the experience like for the advanced practicing nurse?
For the advanced practicing nursing one, we can expose to different specialty and we can have different visits and also practice on the skills. For example, in the palliative care nursing lesson, our professor will teach us some basic but very important nursing skills when caring for the patients which are with terminal disease. And after practicing the skills with our classmates, and we also have chances to practice the skills during the visit. So because we are having the advanced practice nursing too, the next year, so we can also apply this kind of skills when we reach there.
So the great thing about the different subjects from IAPN 1 being the health assessment and the practicum level 1 is that we can combine them to really focus on our field of specialization, advanced practicum 2 in nursing, which I guess you have a lot of experience from, right? Would you like to tell us more about it, Zoom?
Yes. Like Angela already mentioned before, that in the practicum 1 we already get the foundation of knowledge. So in the practicum 1 I get the lesson about the palliative care and hospital. However, in the practicum 2 I have the internship in the hospital, so I have the chance to experience in the hospice department, and also the home care and community care is get a lot of experience. So that's bring me back to the healthcare assessment, that I need to revise, I need to refresh my knowledge again, and then I come back to learn again about the health assessment. It's very necessary and comprehensively correlated with another courses.
And one thing that guides us a lot in everything that we do in the clinical practice is the evidence-based healthcare. We were able to train ourselves to focus more on the literature review, systematic review, all of these evidence-based healthcare approach. And this brings me to the second part of the curriculum, which is the highlight and the core principle of NCKU, which is a research-driven university, right? So, Alfian, let me just go to you and ask, how did the evidence-based healthcare approach help you create a very good model for the field of interest that you have?
Evidence-based healthcare, I learned so much to find out to figure out what is the topic that I can doing and research in the hospital. Also, when I back to doing practicing and internship in hospital, I also learned from the nurse and the doctor about the HIV care related to the article and journal. And also we discuss about the currents, evidence-based that can use to support the caring and the application intervention to the patients.
Aside from that, we have also a wide variety of cutting-edge technology that also Hong took a few months back, right? Would you like to tell us your experience about the medical library?
I took one course from the library, medical systematic review. Yes, I took the systematic review research, and I can apply that course for my course in the nursing research. I can use the knowledge from the systematic review from library department to our department.
Right?
Yeah.
And aside from that, we also have cutting-edge technology in NCKU hospital, in the emergency room, right?
Yes.
Do you still remember that, Nina?
Yeah, I think it's very lucky for the IAP and a student in nursing department here to have the chance to go to the emergency department in visiting class. So at there we have opportunity to see many cutting edge device and tool which is support nurse and doctor in working. Yeah, I think it is very good and I really love it.
Yeah. I'm just so grateful that our university is affiliated and has its own advanced level hospital, which is also a public hospital, right? National hospital. That is a wonderful opportunity if you study here in NCKU, right? And aside from that, actually, we are also guided by a lot of expert professors as our mentors, and we have this specific intimate one-on-one mentor and mentee relationship. Like in my case, for example, I only met Professor Monica in one of the symposium that we had in Thailand. She was introduced to me by a friend from Taipei, and then at the time I never really expected to be here because I already had my decision. And then long story short, I'm here right now, and one thing that I learned from her is that never waste other people's time. Be efficient, work smart so that you don't have to work very hard. And from that, maybe I could ask you your own experience about your mentors and what was the greatest lesson that you learned from them. How did you meet them, and what was the greatest lesson that you learned? Let's start off with, I guess, Angela, would you like to go first?
Yes, and for me, my professor is Professor Thang Suni, and her specialty is in cancer care, wound management. And why I will choose her as my advisor is because I think we share the similar interests on the palliative care and the wound care. So at that time, I just sent her an email and we had a meeting together, and she immediately accepted me. And I think the most important thing is to learn is about the self-directed learning. She never forced me to do any assignment or reading any article, but I will try to read some article and share my ideas with her. I think this is the most important thing I learned from her. Yeah.
Awesome, yeah. What about you, Yadno? Who was your former mentor at that time?
My advisor is Professor Wanji Jant. She is focused on health promotions and also community health nursing. And the other thing is developing program, which is the same what I want. And the other things is my advisors is so kind. She treats us like mothers. And of course, every single improvement, she will be like, okay, you just go. Yeah, I love her so much.
Yeah, I think we all get that same level of support from our advisor. Like the first feeling that I had from my advisor, Professor Monica Ko, is that she trusts me a lot. I think it's the same thing with everyone else. Let's hear more about how Professor Su is guiding Miky.
Well, what I can say about my professor is that I like how she is giving in opportunities. For example, there's a schedule for presentation in my group of advisees with Professor Alice So I was not part of that schedule because they made that schedule earlier. So I contacted her and they said, Professor, I'd like to share my research with you. And she just went there and told them, Miky needs to present on this day because she wants to present. I like how she's giving in opportunities. I think it's very good for students to have an advisor who will be willing to give an opportunity.
And it really helps you like being motivated to finish the task. And I understand the same approach was done by Professor Ani with Alfian and Ho. Would you like to share with us the learning curve that you had with Professor Ani?
Yes, my professor is Professor Shannastaniar, the same as Arnaiz. I know her from Arnaiz too. Yes, I have to say that I deal with Arnaiz because previously that I fight to for the mentor. Yes, I don't know my experience actually. I based on my experience I have pre and post operative care and also infection. It's like a wide topic. I have to narrow my topic, and I got some advice with Alfian. He advised me to be advisee of Professor Shannastaniar, and I know a lot of things with her. I know how to got the topic. Is the important thing that I found my topic research now.
How was she like as a professor, as a mentee? Was she like caring, and then how does she motivate you to become a good, on time with your theses?
Oh, not only the specific thing in the academy. I do the systematic review. It's the different from the nursing research course that we learn in the course from the Department of Nursing. But she taught me how to do that by herself, and also advise her, like a professor or some specialist in systematic review to me. That it makes me finish on time.
Awesome. How about you, Alfian?
So, Professor Chen Yanchin teach me HIV care as my main interest. But I would like to mention specifically on artificial intelligence because she want me to also focus on AI. So I got internship and clinical by mentee, and she advised me to learn more about mobile health to reach people to get utilizations of HIV testing. So that's amazing.
Awesome. Right. It's good that our professors are well updated with the current trends in research as well, right? What about, I think also Nina and Zoom, you have the same advisor. Was it like working with Professor Chi and Kat?
I think she is a caring person. She always give me a lot of inspiration and trust me. Yeah.
Well, and what was the greatest lesson that you learned from her, Zoom?
Actually, the greatest lesson that I learned from Professor is being on time and motivate yourself. As long as you say that I can do it, so sure I can do it. That's the motivation that Professor gave me.
It's not only the trust, but more on the belief.
Yeah.
And it's nice to feel and to experience that our advisors see something in us that we even have that trouble seeing sometimes. You know, there are times in our lives that we feel like we doubt what we can do, but then our professors give us that unique way of making us realize that we can actually do it and we can actually become more skillful than we used to be. Thank you for joining us in this second episode.